I am Dr. Saurabh Bhargava. I am a uro-oncologist, NH Health City in Bangalore. Prostate cancer is common, and one can see that there is an increasing trend towards diagnosis of prostate cancer, including in India. And partly it is because we are becoming more and more aware. One of the problems with prostate cancer, especially early prostate cancer, is that it hardly produces any symptoms. So unless and until you go out looking for it, it is almost impossible to diagnose prostate cancer. This can be diagnosed by a very simple blood test called a PSA blood test. Ideally be done for men who are closer to 50 years of age, or in men in whom there is a very strong family history of prostate cancer. If one looks at the West, because they have been screening for prostate cancer for a long time, you can see the benefits of it. And they have shown that the death rates in the West have fallen down quite considerably. And I'm sure as the awareness increases in India, we'll find exactly the same phenomena. Once you're diagnosed with the disease, what happens next? So the first thing is, once the biopsy is done, our pathologists look at those slides and they tell us how good or how bad the cells are in that biopsy specimen. So you can have very aggressive prostate cancer, or you can have a very milder form of prostate cancer. Once we have decided which type of cancer you have been diagnosed with, and then looking at your general health, how long your life expectancy is, etc., we give you treatment choices. So if somebody has got a very mild form of prostate cancer, those people can be left alone, and all it requires is that they need to be monitored on a very regular basis. The second and the third group of patients, that means the medium risk patients and patients with high risk prostate cancer, these are the ones that we target for treatment. Now, if we treat these patients at an early stage, we know that they will do well. At our hospital, we have got all the facilities to treat these set of people. So we've got the state-of-art Da Vinci robotic systems to carry out complex radical prostatectomies. We have got very good radiotherapy equipment with which we can do focused radiotherapy, so that instead of it taking months and weeks to treat people, it gets over in a matter of a week to 10 days. These are both very effective forms of treatment, and if you can identify the disease early, what it does is that in the long term, people don't develop bad disease and they don't become bedbound. They generally have a good quality of life. And apart from living longer, it is extremely important that you have an excellent quality of life. And that is what we want our Indian population to achieve. Therefore, please go out and test for prostate cancer. And if you are diagnosed with it, don't be afraid. Just go and seek advice, and you will, I'm sure, do well. Thank you.